Welcome to this explainer. Okay, so for exactly 20 years, literally since the Medicare Modernization Act of 2003, seniors have been legally blocked from getting weight loss medications covered. But today, we're breaking down some absolutely dramatic 2026 changes that finally shatter that barrier. We are going completely in-depth on exactly how you can navigate and access the brand new GLP-1 Bridge program. If you or a loved one are on Medicare and have been wondering how on earth to afford these highly effective treatments without completely breaking the bank, you're in exactly the right place.
Here is our quick roadmap for untangling all this Medicare red tape today. We'll start with the high-cost barrier, introduce the GLP-1 Bridge solution, walk through exactly who qualifies, give you some actionable steps to access medications like Wegovy, and finally, look ahead at the future balance model.
All right, Section 1, the high-cost barrier. Does Medicare finally cover Wegovy? Man, this is the exact question so many Medicare beneficiaries have been asking over the last couple of years as the demand for effective weight loss treatments has just completely skyrocketed. It's been a really confusing landscape, and honestly, the answer until now has been incredibly frustrating for millions of seniors. Before we talk about the new coverage, it's absolutely crucial we understand what we're actually dealing with here. Wegovy is an FDA-approved prescription medication containing semaglutide. Now, that is the exact same active ingredient found in Ozempic. But here's the key difference. While Ozempic is approved specifically for type 2 diabetes, Wegovy is approved for chronic weight management in adults with obesity. The clinical studies show it helps people lose a really significant percentage of their body weight. But historically, federal law explicitly prohibited Medicare Part D plans from covering any medications used exclusively for weight loss. It was basically a total blanket ban. And because of that historical ban, seniors had to pay the full retail price entirely out of pocket, often a staggering $900 to $1,300 every single month. For most seniors living on a fixed income, that is just completely unaffordable. But under the new Medicare GLP-1 Bridge program, that out-of-pocket cost plummets to just a $50 monthly copay. I mean, think about the massive financial relief that represents.
Moving on to Section 2, the GLP-1 Bridge solution. Let's see what this program actually entails.
Go ahead and mark your calendars. Starting July 1, 2026, the Centers for Medicare and Medicaid Services, or CMS, is officially launching the GLP-1 Bridge demonstration program. And, while the government isn't exactly famous for moving at lightning speed, this is huge. This represents one of the most significant expansions of Medicare drug coverage in recent years. It's a direct response to the overwhelming medical evidence supporting these treatments and the sheer demand from beneficiaries struggling with obesity. Now, what's really interesting here is the strict distinction in what the bridge actually covers. FDA-approved weight loss medications like Wegovy in both the injection and oral forms, Zepbound's quick pen formulation, and Foundayo are completely covered for that $50 copay. However, Ozempic and Mounjaro remain strictly covered under Standard Part D only if they are prescribed for type 2 diabetes. You cannot get them covered under the Bridge program for weight loss. And a quick heads up, all compounded versions of these drugs are completely excluded. Only the FDA-approved brand names actually qualify.
Let's look at Section 3, who qualifies for coverage, because getting that $50 copay isn't just automatic.
You might want to grab a pen for this part because you have to check 5 very specific boxes to get access to this program. First, you need active enrollment in a Medicare Part D plan or qualifying Medicare Advantage plan. Second and third, you need a formal obesity diagnosis from your doctor, and you must meet the specific body mass index thresholds set by CMS. Fourth, you need the actual prescription from a qualified healthcare provider. And finally, and honestly, this is the big one, your specific Medicare plan must actively participate in the GLP-1 Bridge program. You simply cannot assume you're covered without verifying it first. I also really want to highlight an important exception that exists completely outside of the Bridge program entirely. If you have established heart disease and you are overweight or obese, Wegovy is actually FDA approved to reduce the risk of cardiovascular death, heart attacks, and strokes. Because of this, many Medicare Part D plans may already cover Wegovy for this specific cardiovascular reason. It's subject to your plan's formulary, and it'll usually require prior authorization from your doctor, but it is a vital pathway to coverage that you should definitely ask your doctor about right now if you have a history of heart issues. All right, Section 4, Steps to Access Wegovy. Let's walk through your exact game plan. Don't leave this to chance. Step 1. Pick up the phone and ask your plan directly if they participate in the GLP-1 Bridge. Step 2. Review your formulary to see exactly what conditions they require to cover the drug. Step 3. Work closely with your doctor to submit a prior authorization request proving your diagnosis and your BMI. Step 4. If your plan says no, you are not out of options. You can consider switching plans. And step 5. If you get a denial, remember that you always have the right to fight back and appeal that decision through your plan's formal process. I want to spend a quick second on step 4 because this is where you really hold the power. If you hit a roadblock and your current provider simply isn't participating in the GLP-1 Bridge, you are not trapped. You can use the Medicare annual enrollment period, which runs every single year from October 15th to December 7th, to shop around and find a plan that actually does participate. Taking advantage of this window is just absolutely critical to ensuring you don't miss out on these life-changing medications just because your current insurance company decided to sit the program out. Finally, Section 5, the future balance model. Let's look past 2026. As the name implies, the GLP-1 Bridge is temporary. It starts in July 2026. Then in 2027, Medicare negotiated prices for semaglutide are set to take effect, which should drive costs down even further. But notice that on December 31st, 2027, the GLP-1 Bridge officially ends. What happens next? Well, it transitions into a long-term program called the Balance Model, which stands for Better Approaches to Lifestyle and Nutrition for Comprehensive Health. This means during open enrollments, especially in the fall of 2027, you must proactively check if your plan will participate in the Balance Model, so your coverage continues without a sudden, really expensive gap. And that brings us to the bigger picture. We are witnessing a massive shift from a strict, decades-old federal ban on weight loss medications to a structured, subsidized coverage model. It leaves us with a fascinating question to ponder. As the GLP-1 Bridge paves the way to the balance model, is Medicare finally treating obesity as a chronic disease, rather than just a lifestyle issue? This evolution could fundamentally change the future of senior healthcare and grant millions of people access to medications that can literally add years to their lives. Thank you so much for joining me for this explainer. Make sure you check your plan, talk to your doctor, and take charge of your healthcare journey.